Hello everyone, so we're going to talk today about a type of syndrome or posture that can affect many people. So back in the old days we would call this upper or lower cross syndrome, and we talked about kind of certain muscles being weak, certain muscles being underactive, others being overactive, and kind of terminology like that. So this is the kind of posture that I'm sort of discussing today. So it can, again, another term that we used to use is what's called an open scissor. So your rib cage and your pelvis, their relationship is kind of pushed, or their position is pushed further apart. So ideally, we kind of want this sort of posture whereby our rib cage is right underneath, or right on top, I should say, of our pelvis. And this helps with fluid dynamics and pressure, and pressure being in the right places. So what you'll see people with a bit more of a curve in their lower back sometimes, and then you'll see they have a bit of a distended belly, so a bit of a sort of larger belly. Now, if you look at the rest of them in terms of their limbs are quite slim, but their stomach always seems to kind of poke out a little bit. Also, what you might find is that your backside appears quite large. Again, this is kind of a postural thing, not a weight thing. So they always might seem like they've got a bit of a backside. Um, and this can lead to quite a kind of few problems. So symptoms of this can include an irritated lower back. So the joints of the lower back, because you're in this kind of slightly arched position in the lower back, can get quite irritated, and they can stay that way for quite a while because you're kind of always in that position. Now, I've put anxiety, but I don't mean it can cause anxiety, but it can increase your anxiety. Because if your lower back joints are always kind of irritated, then that's going to make you anxious. So it can actually, I think, increase anxiety in a way because those joints are always being irritated. That's going to send certain signals to your brain that possibly can carry over to your mood and to the way you interact with family and friends. Another problem that you can find with this posture is digestive issues. So you can struggle to digest your food, and that can come out as struggling to go to the toilet, always feeling like you're never empty, using lots of toilet paper, never feeling like the consistency of your stool is what it should be. Obviously, it's maybe on the runny side, so that can be an issue. And then even if it goes on long enough, maybe incontinence at times as well. Um, Heavy legs, so you can feel that your legs are kind of always tired, no matter what you do. Even when you wake up, they feel tired, feel heavy, can't move as well as you used to. And then we said problems going to the loo, digestive issues, not quite absorbing the right nutrients and the right minerals. Hernias. So this posture can sometimes lead to sports hernias or hernias in general, because what you're essentially doing is pushing the belly out and the musculature of the abdomen and closing off the spaces in those lower back joints. That can cause hernias, or a distended abdomen, so a rounded kind of belly, a bit of a tummy. Now, how does this happen? So the rib cage seems to go a little bit further away from the pelvis. So if you imagine when you go to lift something, oftentimes people will kind of push their upper body forward and leave their lower body where it is. So when you kind of reach to get something, and this causes your rib cage to move away from your pelvis and not have that nice pressured environment as this second posture here. So that can be one cause of it, is that your lifting technique, for example. Another thing can be, if you are a person who suffers with anxiety, oftentimes you can get stuck in what we call inhalation. So when we take a breath in, our rib cage tends to tip upwards and outwards, and we can get kind of stuck in that by trying to get more and more air into our system, because when we're anxious, our heart rate goes up and our need for oxygen goes up to replenish that blood that's pumping around a little bit quicker from that. So that's another cause. So anxiety can cause you to adopt this posture. Like I say, lifting technique. One thing as well, sitting. So oftentimes when we sit at a desk, what we'll do is we'll push our head forward and we'll lean in, but then what we do is we try and sit up properly. So again, we kind of arch our back rather than actually sitting up and using our hips. So that can lead to this sort of posture. Driving. So driving can lead to that for sure, because if you're sat in a chair for hours on end driving along, the muscles of your torso are going to get tired eventually. So what they're going to look for is stability, is a nice firm surface for you to be able to stay upright, because we're always trying to say that we should sit upright or we should stand upright, stand with better posture, things like that. But what that's actually doing again is creating that arch in the lower back, which is irritating those lower back joints and weakening those muscles in the front of the abdomen. So that's another cause. Now, like I say, people like this will look like they've got a bit of a belly, they'll have a big arch in their lower back, and sometimes you might even be able to see the front of their ribs through their t-shirt. So the ribs will kind of pop out, or they adopt this kind of almost like a macho kind of thing where they're trying to puff their chest out. And all that's going to do really is irritate those joints at the kind of back segments. So those are the kind of causes, and those are the symptoms of kind of that posture. And one other thing to note is you can have one or the other as well. So the ribs can stick out more, and you can have more of an upper back extension or arch, or you can have a lower extension where your pelvis kind of tips forward and unloads all the kind of weight onto your back. So it can go one of two ways. It can go upper arch or lower arch, or it can be both. Okay, so that's what causes it. Those are some of the symptoms that can come with it that you don't necessarily correlate with them. Now, what do you do about it? So what you want to try and do is you want to try and get yourself in the opposite position. So you want to try and fully round yourself and bring the rib cage and the pelvis a little bit closer together and close off this scissor posture. And we'll link some exercises for you to do with that. But the key thing is, it's not really about strengthening. It's not really about getting stronger in these muscles. It's about improving the connection of your brain and its awareness of what muscles are being used and what muscles aren't being used. Or sorry, I should say the other way. So what muscles are being used or overused and what ones aren't being used. And it's about getting the connection and getting the awareness of how this posture actually feels. Now, not everybody will look exactly like this, okay? And just because you look like that doesn't mean that that's a problem if you've got no pain. All it is trying to make your body aware of these muscles in the front and less aware of these muscles in the back here. So the exercises that we'll show you will use the hamstrings, which actually connect onto the pelvis, to try and orientate your pelvis a little bit more in a neutral position. And again, another thing to say is that don't try and walk around like this, okay? Because if you try and walk around like that, you're going to use muscles that aren't postural muscles. You're going to use muscles that aren't meant to do that job, and it's just not a great idea. There's some research behind it that people who try to actively change their walk end up having pain as well. So that's not what I'm saying. What I'm saying is that people who tend to look like this posture or have that posture have lost the ability to get into almost the opposite position. So have lost the ability to be able to get their rib cage over their pelvis. So all we really want to do is give you the ability to go the opposite way from this, to be able to fully round this lower back and to use your abdominal muscles. And that's all we're trying to do. We're not trying to strengthen anything. We're trying to spend time in the opposite posture so that your brain will realise you'll have more, your brain will realise you have more movement options. And PRI does a really good job of explaining this and of trying to combat that. So I'm just trying to raise some awareness of it and just link those things together, because oftentimes people can come in and say, oh, I've got lower back pain, or I've got shoulder pain, or I've got hip pain, and really it's all about kind of getting them able to access this position here and give them the movement options. So to be able to get into that posture, number one, it's not actually about the postures themselves, it's about having the ability to kind of get into both and have as many movement options. So I'm not saying you should avoid that position, because that is in many sports, that's in many of the things we do. So for example, volleyball, when you do a kind of slam, or in swimming, when we kind of do the initial kind of kick off the wall, we're almost in that position. So again, it's not a bad position, it's not a bad posture. It's just that if people are in this posture all the time, then over time they're going to lose the ability to get into more of a rounded posture and get their rib cage over their pelvis. Okay, hope you enjoyed that one. Take care. Bye.